My name's Carrie Siegel. I'm an abdominal radiologist at Washington University in St. Louis. And I have a subspecialty interest in GU imaging, but I do all aspects of abdominal imaging. So the question is, why is contrast enhanced ultrasound important in renal mass evaluation as we move into the future? One of the most important questions we can answer in a renal mass, whether it's a solid renal mass or a cystic renal mass or a complex cyst, is what in the area of concern is enhancing. And to determine whether something is enhancing, you need both pre-contrast and post-contrast images. So you look at the post-contrast images and compare it to the pre-contrast. There is a subset of patients that either have renal insufficiency or severe contrast reactions and cannot get either iodine-based contrast for CT or gadolinium-based contrast for MR. And rarely patients have problems on both. And this is where ultrasound-based contrast can really help. I'm not going to go into major details on ultrasound contrast agents, but I'm going to just say a few highlights. The ultrasound-based contrast agents are microbubbles. And these microbubbles are little encapsulated microbubbles of gas, which sort of oscillate when exposed to a very low ultrasound frequency. And what happens is when a high intensity ultrasound focus is placed, the bubbles burst and it gives a vascular or perfusion signal. And we can look at that under ultrasound. What's important is these microbubbles are about 3 to 5 microns in size, which is larger than the contrast agents used in CT and MR. So these contrast agents stay in the endothelium and the blood pool, so they're blood pool agents. It's not at all nephrotoxic, they're just bubbles. And then when you turn on the ultrasound pulse, the bubbles pop. It's got a T1/2 for about 5 or 10 minutes. So if you're looking with ultrasound and you're not sure if the lesion is enhancing, you can re-inject microbubbles 5 minutes later and repeat the scan. And if you're still not confident, you could do that again and again. They're just little tiny microbubbles. So we can re-inject and scan multiple times. There's no radiation. And so for this subset of patients where we really need to know if something is enhancing or not, and we don't have good capability with MR post-contrast or CT post-contrast, this is still a fairly undeveloped resource. So we can look at in terms of complex cysts, we can look at the wall, the septations for any nodules for enhancement. Sometimes we're looking at a renal mass and we're not sure it's a real mass or a pseudomass, like a column number 10, a normal area of cortex that's bulged out. But if you look at it with contrast, you can see how it's enhancing exactly like the renal cortex everywhere else. Patients that have had renal, like RFA ablation of a renal mass, the one question you want to answer is the tumor completely dead and defunctionalized, or there are small areas of the tumor that are still enhancing. That's another area for patients who cannot undergo CT or MR contrast, or ultrasound contrast would be helpful. So there's sort of a lot of areas, and it does not require a significant amount of expertise to do this type of imaging. And again, there's no renal toxicity, and the T1/2 is about 5 to 10 minutes. So we can repeat imaging as often as we need to confidently answer the question and to characterize the renal mass in question.